So I'm Jim Del Rosso, dermatologist in Las Vegas, Nevada. I've been here since the end of 1996, practicing dermatology. Previously was in Ohio and in Florida, and then came out here and fairly early on, started a research center here in addition to clinical dermatology. See a lot of psoriasis patients. When I think about changes I have made in terms of how I talk to people that have psoriasis, uh, early on when we started learning about biologic agents, and we've had several come along, patients would say, well, patients that would need to step up to something and maybe had concerns with methotrexate or cyclosporin or difficulty with those or couldn't get to a light box consistently, etc. Those kind of situations. And they're talking about biologics. Well, that's great. The efficacy looks good. Seems like you could monitor the safety pretty well. I don't have any reasons why I can't take them in my medical history. But how long am I going to have to be on this treatment? Right? If I do great after a year, can I stop it as the psoriasis is going to go away? Well, the answer to that is it may go away, but that is pretty unlikely. It's very likely it's going to come back at some point, sooner or later. The idea that you have to be on this therapy for life, potentially that's the case. But at that point, the patient hasn't used that treatment. So they don't know what it's like to feel better, not have the psoriasis, maybe not even have the psoriatic arthritis if that's there, and to be better than they've been throughout their life. This is what they know. Having psoriasis is what they know. They don't know what it's like not to have it or to be substantially improved visibly, symptomatically, socially, intimate situation. Could just picture all kinds of situations that could come up in someone's head when they have scaly plaques on their body, right? Sometimes in areas that you can't see, right? Pretty much potentially anywhere on the skin. So what I tell them, I used to make the mistake of saying, well, psoriasis forever, you're going to need to be on it forever. Big mistake. What I do now, and it's the same with atopic dermatitis also, I say, I think at this point in time, this is a wise decision, right? I can't tell you that it's going to absolutely be free of any side effects, but overall, people do extremely well. And I'll keep an eye on you and intervene and give you the safest course we can and the most effective course we can. You have a great chance of getting substantially better, right? However, if you decide at some point in time that you want to stop, you don't have to see an attorney to get a divorce from this treatment, right? You can just tell me you want to stop it and we can go another direction and tell me why. If it's just for any other reason, right? Whatever the reason is, I want to know. Give me a chance to help you moving forward and not going back to square one. 6 months from now, you come in and your psoriasis is back as bad as it was or worse. You can stop it at any time. That has changed dramatically how people think about stepping in and doing it, right? As opposed to, I'm locked into this forever. You're not saying I do to any of these drugs with a long-term commitment, right? You're saying I do as long as I want to, right? And that is a big difference. And that has helped tremendously.